So we call upon our next speaker, Dr. Aditya Patil, single center experience of the impact of COVID-19 pandemic on 101 patients with uveitis on IMT.
Good afternoon, everyone. So I'll be presenting the single center experience of the impact of COVID-19 pandemic on 101 patients with uveitis on immunomodulatory therapy. So I invite you all to go back to the COVID pandemic period. We all know that the management of non-infectious uveitis patients was particularly difficult due to several reasons like risk of viral infection, severe disease, and immune dysregulation in these patients, and also because of the movement restrictions due to lockdown. So we designed a study to evaluate the patient profile, the episodes of uveitis, the modifications in treatment, the effect of COVID-19 disease, the lockdown and vaccination on 101 patients with non-infectious uveitis during this period. So this was a single center hospital-based retrospective study, and we had 101 patients. So we only took those patients who had non-infectious uveitis and who were started on IMT before or during the pandemic. We excluded those patients with infectious uveitis or those who were not on IMT. So we can see 101 patients were recruited from 24th March 2020 to 31st December 2020. You can see that this was mostly during the first wave, and we followed them up longitudinally all the way up to 31st Jan 2023, and which was in the vaccine era as well. So I'll skip this. Let's go to the results. So we had 178 eyes of 101 patients, and most of them were females, and most of them had bilateral uveitis. We had all kinds of uveitis. Most common was pan-uveitis, followed by anterior uveitis, and the etiology was also diverse. Most commonly, it was idiopathic, followed by sarcoidosis. So when the pandemic struck, 97% of our patients were lost to follow-up. And at the pre-pandemic last visit, 19% of them had active inflammation. But when they presented to us during the pandemic, because of the lockdowns and the prevalent situation, 32% of them had active uveitis. So their inability to follow up was associated with increased risk of recurrence. And this was statistically significant. When we looked at their compliance with the treatment, about 18% of them had stopped IMT. And of these patients, 89% of them developed an inflammatory relapse. So most of them had actually stopped their IMT on their own, and some of them had stopped it due to supply disruption. Then we looked into patients who had continued their IMT during the pandemic. So only 32% of them developed an inflammatory recurrence. So this was statistically significant, and this goes to show that maintaining immunomodulatory therapy during the pandemic helped to prevent inflammatory recurrences. These were the treatment characteristics, and let's look at the details of uveitis relapses. Only 44% of the patients developed relapses during the period. Most of them had 1 or 2 episodes, but in those patients who had 3 or 4 episodes, we saw that 5 out of 8 of those patients were not compliant with their IMT. Then let's look at the treatment modification details during this period. Majority of the patients required alteration in immunomodulatory therapy, and only a minority had adverse events from them. So the purpose is because we were worried whether these non-infectious uveitis patients, when the pandemic was there, they were at risk of contracting severe disease because of the virus, and we did not know the behavior of the virus. So majority of them required alteration, but only minority had adverse events from the immunomodulatory therapy. Let's look at the vaccine era. 6 eyes of 4 patients developed adverse events. So in general, vaccination was safe in these patients. These are the images. The case 1 had a VZV sclerouveitis, and another patient had HZO. And so out of 101 patients that we had in our study, 10 had COVID and 2 had severe COVID. 1 lost his life. Let's look at the details. We can see that 4 patients had continued their IMT and had mild disease, of which 1 patient developed severe disease. Later on, she developed comorbidities secondary to COVID, and 1 patient became critical with COVID, and he had stopped his immunomodulatory therapy. So in our experience, patients who continued the IMT in COVID did not have severe systemic and or ocular manifestations. So we know that in critical illness, when you have a critical illness due to COVID, inflammation plays a much greater role than viral replication. So maintaining IMT was beneficial. And we can see this is the morbidity details in our study. 1 lady, she became oxygen dependent, but she survived the severe COVID. Because she was on IMT. Another patient who was lost to follow because of the lockdown developed CNVM and lost vision. Another patient lost vision due to glaucoma. And when we compared our studies to other studies, ours was the only study with real-world data with a longitudinal follow-up, and we studied episodes of uveitis, the modifications in treatment, and the effect of the disease, the lockdown, and its vaccination. So in conclusion, I'd like to say that inability to follow up due to lockdowns was associated with increased risk of recurrence. Maintaining IMT in the pandemic helped to prevent inflammatory recurrences. Vaccination was generally safe in non-infectious uveitis patients, only a minority having adverse events. And continuing IMT prevented severe inflammatory manifestations of the COVID disease and reduced ocular and systemic morbidity. I'd like to acknowledge our team members. Thank you so much.
Okay, I think it's a little complicated study because only 10 patients had COVID in your 101 patients, and out of this 10, 4 could not make it and 6 could make it.
Only one lost
One
his
died,
life. Yeah.
but 4 had COVID and others didn't
Yes,
have.
of-
So it's an almost equal data.
Yes, ma'am.
So it's a little difficult to say whether it was handing. There were so many compounding factors. Anyway, it's a good study. Thank you.
ma'am.